How old are you?
I am 36.
36 years young?
Yes, sir.
All right. And when did your pain start?
Maybe in my early 20s when I lifted a twin box spring of all things. Lifted it wrong, had my feet together, bent over to get it. I felt something in my back, kind of like a cartoon, just felt the pain and just keeled over to the side. From then I went to the hospital and all they did for me was an x-ray, said nothing was wrong, gave me a pain relief shot and sent me on my way. Fast forward about 15 years later, which was about last year, around this time in October, I started having some heavy tingling and numbness in my feet, which led to just it getting worse and worse throughout the month. So by the time November, December came around, I was barely able to walk. I wasn't even make it to a trip down home to visit my family for the holidays. So my girlfriend came up with a plan to come up on New Year's Eve to go down right at midnight to the ER and to try to finally get some answers. Before then, I was actually diagnosed with type 2 diabetes when the heavy tingling and numbness wouldn't go away. Went to see the doctor, finally got my blood work, and they wanted to see me right away. They wanted me to get on medication for the diabetes. They thought that it was just diabetic neuropathy. Nobody would diagnose me with diabetic neuropathy, but they just kept pushing the gabapentin, kept pushing it more doses. And so finally we went to the hospital and I got a CT scan, and it was revealed that I had 2 herniated discs in my L5 to S1. I felt good that we actually had some diagnosis, but for so long they just kept pushing me down with more medication.
So you found out it was a herniated disc, and then what treatments did you try then?
All they wanted to do really was put me on PT, which I did for about a month or two. Saw multiple pain management doctors. One pain management doctor just said spine injections all you can do, and just have to learn to live with it. Other than that, it's going to be surgery. I actually had one surgeon actually turn me down because I have a bone spur right next to my herniation. And I'm actually grateful for that doctor because he turned me away saying, no, I cannot do it because it's going to turn into something else if we go too much. And we're going to talk about putting bolts and screws in your spine if we have to shave off too much of the bone. Not having the knowledge that I have now, I went and said, no, let's go ahead and do it. He slowed me down, said, no, you're way too young. Do the PT first, and then we'll go from there. After doing that, was a straight downward spiral at that point. Kept getting worse and worse and worse. Was able to finally see a second surgeon. I was scheduled to do a microdiscectomy, and finally I was able to find a spinal decompression treatment, which I have been on and I've been doing along with the program. I was seeing good results, but not enough or not fast enough that I wanted. And I feel like they were getting ready to cut me loose. So that's when my girlfriend actually showed me your videos on TikTok. At first I was a little skeptical, did a deep dive and said I had nothing to lose. So I went ahead and booked the appointment. I went through all the testimonials, read all your medical journals that you have on your website, and said, you know what, it doesn't seem like any other program online. Let me give it a shot. So I signed up for it. The day actually that we had the appointment, I actually was going to see my second opinion on my pain management doctor. I had booked that doctor 2 months out. First time wasn't able to see him for whatever reason. Booked it again. The doctor never showed up. All they said was, we have 2 options. We can switch you from gabapentin to Lyrica, or we can burn your nerves. And I just mentioned that, well, burning my nerves is not going to solve anything. We're just masking the condition. And at that point, I had hit an all-time low.
Emotionally, what were you feeling?
I felt at the end of my rope. I suffered major depression. Everything was affected. My work, my quality of life, my relationships with my family and personal relationships. To be honest, I was not in a good mental state. It got very dark. Got very dark for me.
When that was happening, how close was our phone call?
After I left that initial visit with the doctor, I had maybe an hour or two between our phone call. And I just remember, what is Dr. Jeff going to be able to do that anybody else hasn't been able to do or hasn't told me to do? And I was actually this close to canceling the call. So
ouch.
Yeah. Thankfully, I took it. And just at my lowest point, trying to schedule appointments with doctors, not even able to see one doctor. And I said, what are the odds that I will get you on the phone?
Right.
And I don't know if it was through the grace of God or what, but having that phone call with you really helped.
It really was about 6 to 8 months of trying different things, and some a little bit better, some a little bit worse. So when you finally found my program, what was your pain level then?
I used to be about 350 pounds when I first hurt myself. I finally was able to get down to a decent weight, but still was over 250 pounds. When I joined your program, I was around that same weight, and I was at the pain level at about, I'd say, a 5 or 6 daily, sometimes even worse. It was a daily struggle, and thinking just if I'm able to get this weight off my spine after watching your videos and getting specifically into the nutrition part, I was able to go from, at the moment, from about 240, 250 pounds to what I am now at about 170 pounds.
Wow.
So, and within the last 5, 6 years, I've lost a total of 180 pounds.
Wow. Wow. That's amazing.
Thank you.
Congratulations, by the way, because that's not easy.
Yeah, definitely. And, when I was going through it, I just figured I changed my diet. I've cured the diabetes. This pain's still not going away. I need to find a way out. And I did not want surgery because everything that I've read, and even doctors told me, even if everything goes well, you average a spine surgery every 20 years or so. So I'm thinking, I'm 35 now. I do not want one at 55.
That's no good.
And that's if everything goes well.
So what's your pain level today?
Today, I actually woke up with almost no pain at all. My pain levels have been about a 1 or a 2 at the most, maybe a 2.5, since right now I've moved into my new house. And just about 3 weeks ago, I would not even think about moving, and I was able to do the move. I have somebody help me with the heavier stuff, but
Right.
I was able to get everything going, drive the truck. I couldn't even dream about doing this a few weeks ago.
That's amazing.
If I had to put a number on it right now, I would feel like I'm about 70% back to normal.
And you're 6 months in the program?
About 5 or 6 months into the program, but I will say I am stuck on about week 9 right now due to the setbacks of the medication of the gabapentin, because the gabapentin actually was very, very, very bad for my body. It actually paralyzed my stomach, and
Wow.
through a period of time, I couldn't even do the program. I couldn't even eat. I was pretty much on a liquid diet until a few weeks ago.
You're off the gabapentin, right?
Yes, I'm finally off the gabapentin. I still have some medication for the pain meds, but I only take that as needed. I went from a daily dose of 2,400 milligrams of gabapentin to up to 300 or 400 milligrams of tramadol per day.
Wow.
Now I'm down to maybe 200 milligrams of tramadol as needed per day.
And your life is dramatically better.
Oh yeah, everything. My quality of life is better. My dogs are happier. I'm able to walk them again. My relationships are better with my family, and just personal relationships overall. Like I said, I couldn't imagine doing this a few weeks ago.
When you're in that dark place, it's hard to have relationships. It's hard to do anything, right?
Yes, definitely. You don't want to do anything. I just wanted to get into a comfortable position and just lie down and just stay there.
Anybody that was thinking about this program, what would you tell them?
I would say don't hesitate. Of course, do your own research. I've joined different online back pain pages just to help, because I hear thousands of people, hundreds of people just suffer with this. And if there's a way that I can find to help anybody, at least just reach one person, that's what I want to do. And that's what I have been doing. The program has been great. The coaches have been great. The Facebook group has been great. Seeing people's stories just motivates you. And that's why I posted my story about my weight loss and the journey that I have from the back pain till now. But just going back to that first phone call, it was the lowest point that I've ever felt in my life. And I just thought life as I knew it was over. I did not like that state of mind, because I have family members that depend on me, especially I have a 13-year-old little brother. So as you can tell, he's been my biggest advocate for this. So
that's a great story, man. That's a great story. I really appreciate all your hard work. I appreciate you coming on the video with me. We're going to share this with other people, and it's going to help them as well.
I just want to thank you personally, since you gave me the tools in order to fix myself. Everybody else was pushing me towards the surgery, thinking just get in there, cut it out, be done with it. People don't realize what back pain actually is and what it actually does to a person. And they think it's just a quick in and out with the surgery and you're on your way. But no, I mean, after doing the research and finding out it's 50-50 whether it's going to work or not, those odds are not good.
Yeah, that's crazy. Above and beyond being out of pain, What is your goal?
I want to get back to just the quality of life that I had before. Now being at a healthier weight, I want to go out and do more things. I want to go out and live life. I mean, just in general, I can't wait to go back fishing with my brothers. Every year we try to go out deep sea fishing, and I haven't been fishing in over 2 years.
Awesome. Well, that's the goal then. We're going to get you back on that boat and get you catching some big fish.
There you go. Yeah, I look forward to it. And again, I just want to thank you personally, since, like I said, it seemed like everybody was giving up on me as far as just pushing me towards surgery, and doctor just wanted to push more and more medication on me. And you just don't know how much I appreciate that phone call with you and how that changed my life.
I appreciate it, man. And I love to hear that. I love to hear it. That's why I do it. All right, man. Have a good day.
Thank you.
And keep doing the work. I'm really proud of you. I'm really proud of you.
Now that I'm feeling better, my stomach's back to normal. I'm able to do the exercises. I'm ready to push forward and get past the week 9.
Awesome, man.
All right. Thanks.
Thank you.
Thank you. Bye.
Bye.